Midwifery NMC CBT questions and answers. Question number 26. A midwife's primary role is to choose the correct answer to complete the sentence. Option A. Work within the multi-professional team to ensure best outcomes for women and newborn infants. Option B. Provide continuity of care for pregnant women. Option C. Follow guidance and professional best practice. Option D. Act in the best interests of women and newborn infants at all time. The correct answer is option D. Act in the best interests of women and newborn infants at all time. Question number 27. If a midwife becomes aware that a mistake has occurred, what is done? Choose the correct answer. Option A. Contact the woman's family immediately. Option B. Stop giving care immediately to prevent further harm. Option C. Apply the professional duty of candor. Option D. Correct the mistake immediately. The answer is option C. Apply the professional duty of candor. Question number 28. Prior to commencing any procedure, a midwife will choose the correct answer to complete the sentence. Option A. Gain informed consent. Option B. Follow policy. Option C. Tell the woman what will be done. Option D. Document the plan of care. The answer is option A. Gain informed consent. Question number 29. If a woman chooses to decline recommended care, what is the course of action? Choose the correct answer. Option A. Seek senior guidance on next steps. Option B. Advocate for the woman's choices and plan care safely. Option C. Try to persuade her to follow the recommendations. Option D. Refuse to acknowledge her wishes. The correct answer is B. Advocate for the woman's choices and plan care safely. Question number 30. Should a baby require care in the neonatal unit, it is important to choose the correct answer to complete the sentence. Option A. Communicate with the neonatal team about the newborn baby's progress. Option B. Rely on the parents to inform staff how the baby is doing. Option C. Ensure the woman's and newborn infant's needs are considered together as a priority. Option D. Await neonatal team ward rounds before making any decisions about the woman's and newborn infant's care. The correct answer is option C. Ensure the woman's and newborn infant's needs are considered together as a priority. Question 31. Understanding the social context in which women and their families live helps to inform. Choose the correct answer to complete the sentence. Option A. To support and assistance required to meet their needs and preferences. Option B. The financial needs of families so that appropriate guidance can be given. Option C. The health needs of both women and their newborn infants. Option D. The parents' feeding intentions, enabling sensitive guidance and care. The answer is option A. To support and assistance required to meet their needs and preferences. Question 32. A woman has sustained a third-degree tear. What measure and advice does a midwife offer to prevent infection? Choose the correct answer. Option A. Inspect the perineal area and routinely perform a swab. Option B. Ask a general practitioner, GP, to prescribe antibiotics. Option C. Advise the woman to take analgesia if the area becomes very painful. Option D. Offer advice about why infection occurs and how careful hygiene can help promote healing. The answer is option D. Offer advice about why infection occurs and how careful hygiene can help promote healing. Question number 33. When might a woman become aware of fetal movements? Choose the correct answer. Option A. 16 weeks onwards. Option B. 22 weeks onwards. Option C. 12 weeks onwards. Option D. 18 weeks onwards. The answer is option A. 16 weeks onwards. Question number 34. Which of these medications are included on the midwives exemption list? Choose the correct answer. Option A. Pethidine. Option B. Mifepristone. Option C. Propis. Option D. Labetalol. The correct answer is option A. Pethidine. Question 35. A high-risk result is obtained after serum screening for Down syndrome. What is offered? Choose the correct answer. Option A, an ultrasound scan. Option B, amniocentesis and chorionic villus sampling. Option C, termination of pregnancy. Option D, testing to determine chorionicity. The answer is B, amniocentesis and chorionic villus sampling. Question 36. A woman is struggling with pelvic pain. What is the cause? Choose the correct answer. Option A, urine infection. Option B, pelvic girdle dysfunction. Option C, ligament stretching. Option D, weight of the growing pregnancy. The answer is option B, pelvic girdle dysfunction. Question number 37. What instigates the change from fetal circulation to extrauterine adaptation at birth? Choose the correct answer. Option A, the compression at birth. Option B, delivery of the placenta. Option C, placental blood flow ceases and respiration begins. Option D, an oxytocin injection. The correct answer is option C, placental blood flow ceases and respiration begins. Question number 38. When additional obstetric care needs are identified, how does a midwife consult and initiate referral? Choose the correct answer. Option A, complete a referral form. Option B, arrange a general practitioner, GP, appointment. Option C, call another midwife. Option D, contact an obstetrician and arrange necessary referral appointments. The correct answer is option D, contact an obstetrician and arrange necessary referral appointments. Question 39. A woman is transferred the birth unit to the delivery suite, where the room is bright and has an excess of medical equipment. The woman is afraid. What is done? Choose the correct answer. Option A, dim the lights and try to distract her from the equipment. Option B, explain the necessity of all the equipment and continue. Option C, advise her to lie on the bed and apply the fetal heart rate monitor. Option D, support the woman with her choices and adjust the birth environment to support her needs and reduce her fear. The correct answer is option D, support the woman with her choices and adjust the birth environment to support her needs and reduce her fear. Question number 40. How often does a baby feed in normal circumstances? Choose the correct answer. Option A, on demand. Option B, 8 to 12 times in 24 hours. Option C, 6 to 8 times in 24 hours. Option D, every 3 hours. The correct answer is option B, 8 to 12 times in 24 hours. Question 41. A woman who has had a cesarean section reports the wound is painful, inflamed and weeping. What are the next actions? Choose the correct answer. Option A, support the woman to breastfeed her baby. Option B, perform observations. Option C, apply a new wound dressing. Option D, undertake a full postnatal assessment to identify any risk factors or additional needs and refer as necessary. The correct answer is option D, undertake a full postnatal assessment to identify any risk factors or additional needs and refer as necessary. Question number 42. If a woman is reluctant to hold or engage with her newborn infant, how does a midwife react? Choose the correct answer. Option A, perform a full physical examination. Option B, ask the woman if she is tired and needs a rest. Option C, ask the woman if she is depressed, checking her patient notes for a history of mental health issues. Option D, spend time with the woman and her partner family exploring transition to parenthood and positive family attachment. The correct answer is option D, spend time with the woman and her partner family exploring transition to parenthood and positive family attachment. Question number 43. When providing midwifery care, if a complication occurs, a midwife will choose the correct answer to complete the sentence. Option A, recognize the need to collaborate with interdisciplinary multi-agency teams. Option B, continue with the care pathway. Option C, call another midwife for a second opinion about treatment. Option D, do nothing without first alerting the consultant gynecologist. The correct answer is option A. Recognize the need to collaborate with interdisciplinary multi-agency teams. Question 44. During a critical and complex case, it is important to choose the correct answer to complete the sentence. Option A. Await instruction. Option B. Support the partner of the patient. Option C. Work as part of the collaborative interdisciplinary and multi-agency team. Option D. Focus on midwifery-led care. The correct answer is C. Work as part of the collaborative interdisciplinary and multi-agency team. Question number 45. In relation to the change model for service improvement, what does PDSA stand for? Choose the correct answer. Option A. Plan, document, survey, action. Option B. Plan, do, study, act. Option C. Phase, document, survey, apply. Option D. Page, domain, service and advice. The correct answer is B. Plan, do, study, act. Question number 46. If a critical incident occurs, a midwife will choose the correct answer to complete the sentence. Option A. Report the incident to the Care Quality Commission, CQC. Option B. Undertake a literature review. Option C. Focus on reflection in action. Option D. Report and reflect on the case to contribute to debriefing and ongoing learning. The correct answer is option D. Report and reflect on the case to contribute to debriefing and ongoing learning. Question 47. If a midwife attends a shift where staffing is below the recommended safe staffing level, what is done? Choose the correct answer. Option A. Escalate concerns regarding safety and quality care provision. Option B. Work harder to provide care for patients on the ward. Option C. Ask a colleague to come into work to relieve the burden on team members. Option D. Send women and their newborn infant home. The answer is option A. Escalate concerns regarding safety and quality care provision. Question number 48. New research recommends a change in practice. What does a midwife do? Choose the correct answer. Option A. Change the service the next day in consultation with the senior midwife on duty. Option B. Wait to be told what to do but raise the issue in conversation with colleagues. Option C. Carry on with current guidance until more supporting studies become available. Option D. Appraise the evidence and recommend a service improvement project based on the best evidence findings. The answer is option D. Appraise the evidence and recommend a service improvement project based on the best evidence findings. Question 49. In relation to the Nursing and Midwifery Council, NMC, document, what does SSSA stand for? Choose the correct answer. Option A. Standards for Student Supervision and Assessment. Option B. Supporting Student Supervision and Assessment. Option C. Student Support and Supervision for Assessment. Option D. Supervision and Support for Student Assessment. The answer is option A. Standards for Student Supervision and Assessment. Question 50. How does a midwife identify trends in care provision and implement change to improve care? Choose the correct answer. Option A. Seeing the idea in practice in other midwifery units. Option B. From ongoing conversations with trusted colleagues. Option C. Through the results of audit, research and evaluation. Option D. Using one's own preferences and areas of professional interest. The answer is option C. Through the results of audit, research and evaluation.